So talking about the knee joint or any other joint in that case, it is very important to know the structure of that joint, because the structure is that property of the joint which dictates its function, and the function of the joints is usually the movement, their role in movement. And when we talk about the joints of the lower extremity, movement in those joints is very important because they are involved in ambulation, gait, and moving here and there for a person, so they are very important. So in this section we are going to talk about the structure and the function of the knee joint, in which we're going to take a look at the two major parts of the knee complex, which is the tibiofemoral joint and the patellofemoral joint both. We're also going to talk about the osteokinematics and arthrokinematics of the knee joints, which is the patellofemoral and tibiofemoral joints. We're also going to take a look at the functional working of the knee joint, specifically in terms of screw-arm mechanism as well. So let's start off with the general structure of the knee joint. So as we already discussed and mentioned, that it is made by two joints. We have the tibiofemoral joint and the patellofemoral joint. So the tibiofemoral joint is made by the distal aspect of the femur and the proximal aspect of the tibia, thus forming the tibiofemoral joint. The second one is the patellofemoral joint, which is made up of the posterior aspect of the sesamoid bone, which is the patella, and the anterior aspect of the femur. So the knee joint, and specifically when we talk about the tibiofemoral joint, it seems to be a relatively simple joint, but believe me or not, that it is one of the most complex joints in the body based on the way it is formed and its structure. And it is also one of the largest joints of the body. The knee joint is supported and maintained entirely by muscles and ligaments with no bony stability, because when you take a look at the knee joint, the tibial plateau is almost flat. It is not much concave, so it does not offer much corresponding or stabilizing surface to receive the highly convex bony partner, which is the femur. So that stability is provided by soft tissue structures such as menisci and ligaments. Moreover, when we talk about the knee joint, it has osteokinematically 1 degrees of freedom, but because it does not have a lot of bony congruency and bony stability, if we want, we can actually passively move it in all 3 axes and planes. So it makes it very confusing that how many degrees of freedom does it have. If we specifically talk about its voluntary movement, then we can say that it has 1 degrees of freedom. But according to Norton J. Franklin, when we talk about its movement, so whenever we do flexion and extension, we do also have a movement of internal and external rotation of the tibia. So if we consider that, it becomes 2 degrees of freedom. But that movement, even though it is the movement of the shaft as well, and it is in the form of spinning, but that does not occur voluntarily. So in that sense, it is once again 1 degrees of freedom. But if we talk about able to move the joint passively, we can passively move the joint in flexion, extension, rotation, and as well abduction and adduction. But once again, that is not osteokinematically and voluntarily possible. So in that sense, it is once again 1 degree of freedom joint. As I already mentioned, that is one of the biggest joints of the body, and it is involved in ambulation and gait and also weight bearing. So it is one of the most frequently injured joints in the body, and it is also one of the most weight bearing joints in the body. And as I already mentioned, it is also one of the largest. And it is classified as a synovial hinge joint because osteokinematically only flexion and extension is possible. But it is not a simple hinge joint, as I already mentioned. It is a modified hinge joint. And that is because, unlike the elbow joint, in which there is pure flexion extension, it also has movements of internal rotation and external rotation whenever we do flexion and extension. So that brings us to the movements that can occur at the knee joint. So osteokinematically speaking, we have 2 movements, which is flexion and extension of the knee joint. So if we talk about these movements, so the movement is possible from 0 degrees of extension. So when we are actually standing straight, our knee is more or less in 0 degree of extension. And then we can move it backwards into flexion to around 120 to 135 degrees of flexion, which can be measured via goniometer. However, unlike the elbow, the knee joint is not a true hinge joint, as I already mentioned, which brings me to the point because it has a rotational component. Because whenever we extend the knee joint, the tibia rotates externally and the femur rotates internally. Once again, when we flex the knee joint, then the tibia rotates internally and the femur rotates externally. And that brings that rotational component, thus it can be more or less known as a modified hinge joint. So as rotation is not a free motion, it is an accessory motion which we cannot perform voluntarily, that accompanies flexion and extension, so that is not included as a voluntary degree of freedom. So we can in one sense say that it only has one degree of freedom. Now, talking about the arthrokinematics of the knee joint, arthrokinematics are those movements which actually occur as joint play, and they occur involuntarily, but they are actually component motions to perform an ideal osteokinematic movement. So the articular surface of the femoral condyle is much greater than that of the tibial condyles. It is very big, and as I already told you that the bony surfaces are not very good in terms of congruency for each other. So that if femur roll on the tibia from flexion to extension, the femur would roll around like a ball and it would eventually fall off the tibial plateau or the tibial surface. So for that region, we need to have some sort of joint play or arthrokinematics. So what happens is that whenever the femur moves, then as the femur rolls, let's suppose forwards, there is an equivalent glide backwards as supposed by the convex and concave rule, thus keeping the femoral condyles or the femoral articulating component within the joint or within the tibial plateau. So femur must glide posteriorly on tibia as it rolls into extension. Or we can, if we take about the consideration that the moving bony partner is tibia, then the tibia follows the concave on convex rule, and as we go into extension, so tibia goes into extension and there is an anterior glide of the tibia, but there is a posterior glide of the femur in terms of extension because that follows a convex and concave rule. Moreover, articular surface of the femoral medial condyle is longer than that of the lateral condyle. So whenever extension occurs, the articular surface of the femoral lateral condyle is used up while some of the articular surface remains on the medial condyle. So that brings us to the point when I mentioned that rotation occurs whenever there is flexion and extension. So whenever there is extension at the knee joint, the tibia rotates externally and the femur rotates internally. So medial condyle of the femur must glide posteriorly to use all of its articular surface, and it is this posterior gliding of the medial condyle during the last few degrees of extension that causes rotation at the knee joint, specifically internal rotation of the femur and external rotation of the tibia. Now this rotation component is also very important in terms of functional anatomy because it is involved in a mechanism which is known as the screw horn mechanism of the knee joint, and which is also commonly known as knee locking. Now during the last few degrees of motion, as I already mentioned, the tibia goes into extension and the femur goes, the tibia goes into external rotation and the femur goes into internal rotation, and this locks the knee joint in a state of extension. So this is known as the screw horn mechanism of the knee. Now when the knee is fully extended, because of this screw horn mechanism and rotation at the knee joint, an individual can stand for a long time without using his dynamic components such as muscles to keep himself in a standing position because his joint is locked and it cannot go into, or it will not go into flexion. Moreover, the knee must be unlocked by femur rotating laterally on tibia or tibia rotating medially on femur for knee flexion to occur. And that is why the internal and external rotation of tibia on femur or femur on tibia, which is the rotational component of the knee joint, even though it's not a osteokinematic movement, it is an arthrokinematic or accessory movement, is very important for the normal functioning of the knee joint. So a small amount of rotation on femur or femur on tibia or tibia on femur keeps the knee from being a true hinge joint. That's why I already mentioned in the previous slides that it is a modified hinge joint. Because this rotation is not an independent motion, as I already mentioned, it will not be considered as a degree of freedom and an osteokinematic movement. Moving on, the other component was the patellofemoral joint, and it is the articulation between the femur and the patella. The posterior surface of the patella is very smooth and it glides over the patellar surface of the femur. And the function of the patellofemoral joint is very important because it actually increases the mechanical advantage of the quadriceps muscle. How it does that? It actually increases the moment arm of the quadriceps muscle. And talking about the moment arm, I am talking about the effort arm. So when we increase the effort arm, we need less force to be exerted by the quadriceps to bring about the same amount or same level of torque. Moreover, the patellofemoral joint also protects the knee joint, or the conventionally speaking tibiofemoral joint. Now, as already mentioned, that the patella increases the mechanical advantage of the quadriceps. So how does it do that? So let's take a look into it. So by placing patella between the quadriceps tendon and the femur, it increases the distance between the attachment side of the quadriceps and the origin side of the quadriceps because the quadriceps muscle now has to move over the patella and cover a greater distance. And secondly, it also alters the action or the line of action of the quadriceps, and it also increases the effort arm. So as the effort arm or the moment arm is increased or lengthened, it results in a greater angular force, which is known as torque. So by exerting a lesser amount of force, the muscle can result in a greater amount of torque. Without the patella, the moment arm or the effort arm would be smaller, and much of the force of the muscle would be a stabilizing force directed back into the joint instead of the angular component of the force. So that was all about this lecture in which we talked about the structure and function of the knee joint. I hope you learned something new out of it. And if you want to watch the other lectures in this series, so keep on watching sqadia.com, and I hope you learn more about the knee joint and anatomy. So please stay tuned.